Assalamualaikum guys. Have a very good day to everyone. So welcome to infection prevention and control in dentistry. This module is under DFC401, which is comprehensive care and practice management in dentistry. So this module will be taught to all year one students prior to entering to dental clinics or clinical training. Okay, so for this module today, I would like to introduce you to this module before we proceed to other topics. Okay, so this topic will be very relevant to all of you now, and also with the current situation going on with the COVID-19. So you know how important is infection prevention and control. So you have learned a great deal for the past few months with the current situation. So we will explore in details about the infection prevention and control, specifically for us as a dental or oral health practitioners. Okay. So this course will be taught by several of us. So I am the course coordinator, and for any reasons that you have or any inquiries that you have, please do contact me. I will give you my contact and also email address later. Okay. Dr. Ariza, professor in pathology from medical school next door. So she will be teaching you some of the topics in this module. Okay. And also Armin, senior lecturer in microbiology from our faculty. She'll be teaching us, you guys, in several topics too. Okay. So to start with our introduction today, everyone knows, okay, about the infection, and you probably have some ideas about what is infection all about. You have learned probably in general module of your sciences about the viruses or the microbes, okay? So we need to learn a little bit more about their functions. We need to know what are the effect of their presence in our body or in the surface of our clinic, okay? So or in the environment situation. So we will explore all these details and how's that going to affect us as a practitioner or oral health practitioners, and how's that going to affect our patients who we are treating or we're seeing them in the clinic. So to start, highlighting one of the common things that you have in your daily life or daily activities is your smartphone or your handphone. Okay, so if you look at the photo on the right side, you'll be looking at this agar plate who has been swapped with different samples from different locations. Okay, so you have toilet handle, you have doorknob, toilet seat, and also cell phone. So if you look at these photos, okay, based on your previous knowledge on your microbiology or basic microbiology, you know if there's something on the agar plate, it means some growth is going on and it's collected from the specimen area or from the collection area. So you can see here the cell phone has a lot of growth there, and it probably comes from different types of microorganisms. Okay. Looking at a toilet handle, surprisingly, it's not that much, right? And looking at a doorknob or toilet seat, it's there, but there are microbes, but not as much as cell phone. So it's something that you need to wonder what you need to do every time you use your handphone or cell phone. Okay, so this photo just try to opens up your mind about what are you doing in your daily life, right? It's not just a handphone, it's probably your keys, it's probably your clothes, right? And also your watch. So these things could be a medium for the microbe transfer from somewhere else to your body. So you need to be more aware or alert of this environment, okay? But at the same time, we do not have to be phobia of these things, okay? Some people get really freaked out when they see this, and they tend to sterile everything that they want to touch. For example, the doorknob, they use the what we call this, they use tissue just to open a doorknob, just to use the doorknob, or they use tissue just to use the toilet handle. Okay, so we don't really want to be in that situation or really freaked out about this, but we need to be careful when we are using these contact surfaces. Okay, so um, in this module, we will tells you what we need to do, and we don't have to be extremists on both ends, or you have to be careful, you have to be alert, you have to be well informed about what's going on or surrounding you. Okay. I will show you this video from WHO about infection prevention and control programs. Okay, so please have a look first of this video.
Infections acquired during healthcare delivery are a major problem for global health, causing harm to patients and putting the very notion of safe, trusted health systems at risk for all countries. 1 in 10 patients get an infection while receiving care. Infections cause up to 2/3 of deaths among hospital-born babies.
These are just a few shocking problems we are facing in our world.
But healthcare-associated infections are avoidable, and to prevent these infections, including those antibiotic-resistant, is a key priority for WHO. This is why WHO has engaged experts and colleagues with field experience to resolve this problem. Also based on scientific evidence, we all together identified the core components that make IPC programs successful to prevent harm.
The new core components are absolutely essential for us to have for low resource settings, because WHO documents carry a lot of clout with the ministries of health. It can prove to be cost effective, but most importantly, the IPC focal people working in healthcare facilities find it a great support, and it gives them the clout to do their job properly.
So infection control is really critical to the control of antibiotic resistance. If you think about the spread of antibiotic resistance, it's just like a bushfire. And of course, yes, we need new fire trucks and new helicopters, that is new antibiotics, but they're 5 or 10 years away. And in the meantime, we need a fire break, and that fire break is good infection control. And so this is why the core components are so critical. Whether you're a wealthy country or a poor country, all countries need a national policy on infection control, and the core components are exactly what we need to direct that effort.
WHO recommendations identify 8 core components that make infection prevention and control effective and aim to support countries and health facilities to prevent healthcare-associated infections and antimicrobial resistance. The first component is about having an infection prevention and control program supported by a dedicated budget and trained staff.
Infection prevention control programs are essential in healthcare facility level because healthcare-associated infections lead to high cost and high mortality.
In order to ensure establishment of strong infection control programs, we need to make sure there is political commitment at the highest level, starting with resolution at the World Health Assembly, and then moving on to establishment of regional programs.
The second component is to have and implement guidelines on infection prevention and control standards and operating procedures.
For us, guidelines provide a standard that we can follow, we can all agree on. So now we have, like for example in Chile, the healthcare providers, the directors of the hospitals or the infection control programs use the guidelines in order to allocate resources or organize healthcare in order to make it safer for patients.
The third component is education and practical training based on infection prevention and control principles and best practices for healthcare workers, managers, and other professionals.
Education and training can change practice if we do 4 things. Number 1, if we contextualize within their experiences. 2, make it very practical. 3, have champions to drive the process. And 4, get the administrators involved by having a proper advocacy plan.
The fourth component is healthcare-associated infection surveillance and timely feedback of results, both at the national and facility level, to detect the problem and guide interventions.
So when hospitals do surveillance, they usually measure the burden of infections and describe the pathogens causing infections and their resistance pattern. Good quality surveillance data contributes to tailored prevention activities to reduce the burden of infections and resistance of organisms.
The fifth component is the use of multimodal strategies to implement recommendations to improve practices at the point of care.
These guidelines reinforce the value of multimodal strategies for decision makers, for leaders, for implementers. And what this means is making sure the right resources are in place, the infrastructure to support improvement. It means using the most effective methods of training and education. It means checking that the right thing is happening at the right time, monitoring and evaluation and feedback. It means communicating and advocating and campaigning for infection prevention, and all of this taking place within a culture that supports improvement in infection prevention and control. All countries and all health facilities can benefit using a multimodal approach to protect people.
The sixth component is regular monitoring of healthcare practices according to standards and guidelines, followed by timely feedback of the results, both at the national and facility level.
I think monitoring in the field of infection control is a very important issue. And for instance, I would like to give you an example from my own country. We have established hand hygiene consumption as an indicator for good hand hygiene. And meanwhile, more than 1,000 hospitals in our country are using this indicator, and we were able to achieve a lot of increase in this field.
The seventh component is to make sure that bed occupancy does not exceed the standard capacity of the facility and that staffing levels are adequate according to patient workload.
Level of staff and bed occupancy, we have 3 major challenges to overcome. First is the lack of human resources on IPC. The second is the lack of the involvement of administration. And third, we have a lack of involvement of patients and families. So we have to address all these challenges if we want to overcome this problem.
Establishing a team at the national level provides guidance and leadership that could accelerate the momentum that is needed to ensure that IPC is implemented throughout our country.
The eighth component is to ensure that patient care activities are undertaken in a clean, hygienic environment with adequate infrastructures and equipment, in particular for hand hygiene.
Water and sanitation are absolutely fundamental to preventing infections. I think this is overlooked. We know it's overlooked. We did a global report where we understand that 40% of hospitals are without, a source of water, and that's unacceptable. We walk into these health facilities and we see unhygienic conditions, and we know diseases are going to be spread. So this is something that is absolutely wonderful that it's been included in these guidelines as a prerequisite.
The last public health emergencies of international concern that was declared by the WHO so showed that how important is to have infection prevention and control in place for member states to fight epidemics and fight emergencies. If we are better prepared, if we have infection prevention control structure in place, we have a better chance to fight these emergencies.
One of the great lessons learned from outbreaks like Ebola and MERS and SARS is the importance of strong infection prevention and control from a global health perspective to prevent the next epidemic.
Effective infection prevention and control can lead to more than 30% reduction of healthcare-associated infections. However, implementing the recommended core components isn't always easy and takes time and commitment. But there are great examples around the world that this is possible, even with limited resources. Countries and healthcare facilities engaging to do this will reduce infections and antimicrobial resistance and will save money. Most importantly, this will make patients safer and save lives. Thank you for committing to infection prevention and control.
Okay, so this video is just to to appreciate what is going on globally as well from WHO and how important is infection control, okay, and prevention. So there are a lot of programs being carried out worldwide to make sure that every healthcare facilities or every healthcare workers to follow these programs so that this we could control the contamination or the spread of diseases. Okay, so that is an opening video for you guys to appreciate the whole thing about infection prevention and control. All right, let's move on. For this introduction to the course or module, I will talk about the outcomes, okay, the course outcome or module outcomes, the content of this module, and how we deliver this course as well. And definitely you would like to know about the assessment from this module. And then I would like to say a few words about expectation from this module, okay? Course outcome first. There are 5. The first one is to describe the different types of infectious agents or microorganisms and the harm that they can cause. So number 1, you actually have done probably in microbiology module from the other course. So you could appreciate better in this course where how this microorganism would harm our patients or ourselves, and how to deal with them, definitely. So by having a knowledge about these infectious agents, you could understand better all the procedures or all the protocols that we propose to be followed when you are in the clinic, okay? Number 2 is to apply and comply with standard precautions in all episodes of care and service delivery. So the most important here is standard precautions, okay? So we will expose you, we will ensure that you comply with the standard precautions when you are in the clinic, definitely when you are dealing with patients, okay? Number 3, to differentiate between cleaning, disinfection, and sterilization. So these 3 terminologies have a different meaning and 3 different processes, okay? And when each technique is utilized in a dental office, so you need to know when to use this technique or what instrument or what kind of procedures that you have to use these techniques, okay? So we will do that. Number 4, to demonstrate proper techniques and methods of infection prevention and control. in dental clinics and related areas, right? So these are very big. Number 4 is quite big because it has a lot of things going on in the techniques itself, okay? So there are waste management that you need to know, which waste goes to which bin that we have prepared in the clinic, all right? So there are 3 bins and you have to know what goes in it, all right? So that's one of the example for number 4. There are others, okay? Number 5, the last one, recognize the professional's responsibility to adhere to scientifically accepted infection prevention and control practices in all healthcare settings and the consequences of failing to comply. So as a dentist, when you graduate later, you know what is your responsibility. You probably one of the leader in the clinic, so you have to have some sort of mechanism to comply with this programs or protocols that has been put in place by the Malaysian government or the authorities, the relevant authorities. Okay, so if looking at Malaysian environment, so we need to comply to Malaysian Dental Council regulations and also the acts pertinent to the infection control. Okay, so these 5 course outcomes that we're going to address in this module, so that you know when you go to the clinic, you are well prepared. Okay, you know how to protect yourself and you know how to protect your patients. Okay, so for the course content, number 1, we have Unit 1, Basis of Infection Prevention and Control. So we will talk about that a little bit in Unit 1. Unit 2, the science of infection. Unit 3, prevention of infectious diseases. Unit 4, cleaning, disinfection, and sterilization. Unit 5, clinical protocols and setup. Unit 6, special areas, and Unit 7, management. So each of these units would have several topics underneath it. So when you open up the MOOC platform, you'll be seeing these units and also the titles inside of each unit. Okay. Another video. This video is actually quite an eye-opener for all of you, I guess, because you are new to dentistry and you're just about to know what dentistry is all about and how do we do our things in the clinic. And this video is actually looking at how contamination can occur from saliva. Okay, so as you know, saliva is not colored. Okay, but this video will show you what if saliva were red. Okay, so the first part of this video will show you the actual procedures being carried out without abiding to all infection prevention and control protocols. And then the second part of the video is where they show you what if saliva were red. So you can see the appearance of the patients and the what we call this, the dentists and the assistants, and also the surfaces or contact surfaces in the clinic itself. Okay, so let's watch this video first. Okay, so I think you could appreciate when seeing this video. When we are in clinic, we have to really abide to the protocol so that we could avoid this kind of transmission in the clinic, okay? So hopefully this video could give you some ideas what's going on in the clinic and what should you be doing. So at the end of this video, it was quite comprehensive to show you what need to be done, okay? What need to be worn, or what should be done during clinical or treatment, okay? All right, so let's move on. So for this module, the delivery would be by slide presentation, voiceover, something like what we are doing now. And there are some videos also for you to watch, which we will put in the MOOC platform. And we would also have some clinical training when you come back to the dental school later, okay? So at this moment, we will only do slide presentation and demo videos over the MOOC platform. That's all, okay? All right, the fun part. So as for the assessment of this module, you are required to do infographic posters, which is a group work, luckily. And the topic has been provided in the handbook, which I will mention later. So this infographic poster will produce 20% of the total marks in this module, which is due on the 12th of August 2020. The second one is the practical assessment, which we will do when you come back to dental school later. So this is, for example, like a hand wash. So we would ask you to do hand wash. So you would perform a hand wash in front of us, and we will evaluate your protocol or your hand wash technique. So that would contribute 30%. So for now, as of now, we're still waiting for the final dates of your timetable, and it's still not known yet. So we will inform you about the date later. Okay. All right. This course also would have the final part of assessment, which is the MCQ. So there would be 30 questions, and it will be provided through online through the MOOC platform as well. So this actually would comprise of 50% of the marks, and it will be done in 26th of August 2020. We will provide you more details about this MCQ later. Okay. All right. So what are our expectations to complete the unit or every unit? Okay, as per guide. Watch the lecture series by us and also watch the demo videos, and then when you come back to the dental school, we will do some practical when you come back, okay? To do the assessment as per date provided. So if you have any questions about the infographic posters, please do email me or WhatsApp me about that. Perhaps the team leader of each group could do the communications with me so that it won't be so many communications and it will create more confusions later, okay? And also to engage in virtual communications via forum, so we would have some discussion or some Q&A in the MOOC platform later in the forum section, okay? So I have prepared a student's handbook for this module. So it has been uploaded in this MOOC platform. Please do read, because in this IPAC student handbook, it would have a specific topic and student learning outcomes. Okay, so you could read these topics, the details of the topic, and also the student learning outcomes for each of the topics. Okay, so that will be the guide for you to learn about this module, despite of having all the textbooks. Okay, so I have given to you the textbook earlier, the digital copy of the textbook. So it's quite a good book for you to have a look. You don't, if you have time, please do read the book on your own, and definitely the content of the book would be presented in our module. All right, probably 90% from the book will be presented in our module. All right, so that's about handbook. Right, so for technical issues, you could contact this number because MOOC is 24 hours, definitely. If you have any problem, you can just email or call if you have any problem with your account. Okay, for the content or assessment, you can contact me. All right, for that matter, thank you for joining this first introduction to the module, and we will inform you again for the next step, because this MOOC platform would be the main delivery mode for you all, but due to some certain reasons, some of the content are not uploaded yet. So I would probably have some live video sessions later, or live demos and all. So I would inform you in the meantime. Okay. For that, thank you very much. And please, I would send a attendance link for you guys through your class rep, so that please fill in after this lecture your attendance. Okay. Okay, with that, thank you. Assalamualaikum and good day, everyone.